right.
All right. Hi, welcome to the Alumni Conversations for Visits Days 2021. We're really excited to have everybody here today. I see a lot of our prospective students in the audience, and we have a great panel with you today. We're able to answer any of your questions. We're going to field a few questions to them at first to get things started and warm things up, but then we'll open up the conversation later for you to ask questions, or you can put them in the chat. We'll be fielding them that way. If you don't feel comfortable fielding before the whole group, if you'd like to type them in, we'll collect those questions as we go along. But we've also collected some questions prior to that, and so I have a list that I can use. My name is Daren Wade. I'm the Director of International Experiences and Career Resources here in the Department of Global Health. It's part of academic programs and student services. I'm covering temporarily for the PhD admissions process. So I know some of you in the audience here while my colleague is out on leave. And so I wanted to first, before I have the panel introduce themselves, I'd like for my colleagues to introduce themselves. Nora and Basha, if you'd like to, they're in the audience as well.
Hi, I've met almost everyone here. My name is Nora Yusufa. I'm an academic advisor for the Global Health MPH and the undergraduate programs. Welcome.
Hi, everyone. I'm Basha Otto. I'm the Communication and Event Program Specialist here at DGH. So I'll be primarily working on events for everybody as well as alumni relations.
All right, great. So the Alumni Conversations has been going on for a number of years here in the Department of Global Health to give our opportunity for our students to be able, oh, and wait, I see Steve Gloyd in the audience too. Wait, hello, Steve. Want to introduce yourself to people who maybe have not gone to another session, maybe don't know you yet.
Okay, well, hi, thanks, Darren. I'm director of the MPH program in Global Health, and I think I've met most of you this morning, but it's great to see you again. Again, congratulations. And I'm here not only to be with you, but to hear these fabulous alumni talk. Most of them really well. So.
Yeah, okay, great. So Alumni Conversations has been going on a number of years, here to bring our colleagues, part of our family of the Department of Global Health, bring them back and share their experiences outside of the classroom, what they've done post graduate school with our current students, and during visit days with the opportunity for our prospective students to also get to hear from them as well. We want to make sure that we keep connected to them, and then if you have an opportunity to reach out to them as well, that there's a continuation of experience and learning and mentorship and connection throughout the global health community at the UW. So we're really excited today to have our panelists here today. We have 5 today. I think one is, we're still waiting. Is Sarah here? Okay, so we have Lily Alexander, Vijay Narayan, Anyanya Ede, and Farah Mohammed. And later on, hopefully we'll get, and they're all graduates of the MPH program. And then we have Sarah Wolf Hansen, who's a graduate of the PhD program in metrics, who will join as well. So if you have specific questions for a PhD student, you feel free to reach out and ask those questions as well. But you can ask questions of any of the of the alumni here who are here to share their experiences. So what we'll do at the beginning is we'll have each of them introduce themselves. So we'll go in alphabetical order. We'll go from Farah to Lily to Onyenye and Vijay, who can give your name, your cohort year and track, your current position and job title, and what you do for work in a nutshell. So basically introduce yourselves. Lily, Farah first.
Hello, everyone. My name is Farah Mohammed. I am the cohort of 2014. I graduated with MPH, Global Health, and Masters in Social Work. Currently, I work with Sierra and King County Public Health, doing mostly food safety and recreational water inspection, and this includes routine inspections, ensuring that restaurants are following food safety requirements and recreational water is up to the standard. And also I do food investigation if there is a foodborne illness outbreak. Besides that, I'm also I have founded a consultancy firm, Bile Consulting, consulting firm that does research, education, and outreach, and translation services to address health disparities within our county. I am also part of Somali Healthborne Leadership, a nonprofit organization that addresses health disparities within our state. I also work with a National Resource Center at the University of Minnesota to address a challenge related to COVID-19 at the national level. Thank you. It's a pleasure to be here with you today.
Thank you. All right, Lily.
Hi, everyone. I'm Lily Alexander. Fun to go after you, Farah, because I also work at Public Health Seattle and King County. I did the health metrics and evaluation track and started in 2014, but took a year off in the middle. So if anyone has questions about slightly more non-traditional means, I'm happy to talk about that. Graduated in 2018, and I'm currently a communications specialist at Public Health Seattle and King County. So I work on communications team that has grown to about 20 people during COVID-19, and I started about a year and a half ago, and mostly work on digital communications. So a lot of blog, social media, and web. And also a lot of language access work. We've really ramped up our language access efforts during COVID-19. And primarily, I'm currently working on a lot of vaccination messaging, largely through social media and web, and trying to kind of run the communications around our 2 vaccination sites in Auburn and Kent. And prior to that, I was mostly doing reproductive health work in the county. I was working on a program to increase access to emergency contraception for young people, to create a model of youth-friendly pharmacies. And that's still kind of work that I try to continue to do on the side when I'm not communicating about COVID. And that's all.
Thank you, Lily. Okay, Onyenye.
Great. Good evening from Silver Spring, Maryland. Good afternoon to the rest of you, or good evening, good afternoon. I am Onyinye Ede, and I am from cohort 2011. Yes, the 2011 cohort. I graduated in 2013 with my MPH in global health, focused on the health of women, girls, and adolescents. I currently live in Silver Spring, Maryland, and I work with the Now Family Planning 2030 partnership, which is basically a global partnership to ensure that women and girls have access to family planning methods, to modern family planning methods. I'm getting into my second year with Family Planning 2030. We used to be Family Planning 2020. We transitioned this year. We launched the new partnership in January. And my role is I was recently promoted to officer for the Anglophone Africa region. And in my portfolio, we have 18 countries, 18 English-speaking African countries. And I manage 9 of those countries, of which my home country is one of them, Nigeria. And basically my job is to support governments, civil society, and youth partners, also our donor partners, to make sure that we are providing technical assistance, providing whatever kind of support is needed to make sure that women and girls who need these life-saving contraceptives are getting access to them. So yes, I'm looking forward to sharing more about what I do day to day, but it's really a pleasure to be with all of you. I also run a 5-year-old nonprofit organization. We actually celebrated our 5th anniversary last week, and we work on girls' education and women's empowerment, mostly focused in Nigeria.
What's it called?
Strong Enough Girls Empowerment Initiative.
Awesome. Thank you, Onyenye. KVJ. Your mic's off.
All right, mic's on now. Hi, my name is Vijay Narayan. It's a pleasure to be here. I'm in the 2012 class in the general track. I'm currently working for USAID's Global Health Bureau as a senior public health advisor. Working in the Office of Infectious Disease in the Emerging Threats Division. The focus of my role is to be a technical advisor focused on outbreak and pandemic, in this case, prevention, preparedness, and response. The division I work in, and the team, I mean, we are engaging in a range of activities, starting with trying to prevent pandemics in line with the global health security agenda, and then also trying to enhance preparedness of countries to respond and to actually respond. And right now, for example, we are engulfed in the current Ebola outbreaks that have sprung up in DRC and in Guinea in Africa, as well as with the COVID pandemic, COVID-19 pandemic. Prior to, I've done this for a few months, but I was previously in Somalia for the preceding 2 years with working with IOM, the UN Migration Agency, and managing the humanitarian health operation that we were operating throughout the country. So I was the coordinator of the health nutrition, mental health, psychosocial support, and health system strengthening program. It's good to be here. So thanks for having me.
Thank you. Thank you, Slim. We're still waiting for Sarah, but I'll begin the questions. We have a lot of prospective students here, of course, and this is the time for them to visit and get to know more about our school. But can you let us know, for you, how did you make the decision to choose UW for your graduate school? Like, what were the factors that were attractive to you that you chose the UW over other schools or other programs? Anyone? You just raise your hand first if you want. Farah?
Yeah, I will go first. When I was doing my undergrad program at UW, I was doing social work, and I was introduced to the concept of global health by a class taught by Steve Gloyd. He's here right now. And the information that I got from that class was really amazing. And the moment that I stepped into that class and took a few sessions, I knew what I wanted to do. So the moment, before even I finished the undergrad program, I applied to both MSW and MPH program. And luckily I was accepted into the program. And when I was going to the, doing the courses I was doing concurrently, and luckily finished both degrees within 2 years.
Great. What about others? Anybody who didn't go undergrad to the UW, or this is a brand new school that you did? Anyanya, you have your hand up. Thank you.
Yes. So I would actually say UW chose me because I literally found out about UW like a day to when the application was due. I kid you not. So I'm from Stone Mountain, Georgia. That is home for me. So I attended a private liberal arts college for women called Agnes Scott College in Decatur, Georgia. And I just happened to be having a conversation with the president of my college, telling her about the schools I wanted to go to. Emory was my top choice then because Emory was next door. I had heard so many great things about Emory. I knew I was going to Emory. And she's like, hey, why don't you check out the University of Washington? And I thought Washington, D.C., like I had no idea. So I'm like, well, sure. I go online, I find out Seattle. I'm like, what Seattle? Where's that? Anyway, I'm like, okay, deadline is tomorrow. The president of my school has recommended it, so let me apply. Long story short, I got my application in like close to the deadline, had to get recommendations and all of that. And then I came, the seller for me was, I got a chance to come visit during visit days. And unfortunately, you all don't get to come on campus, or maybe some of you are able to, but due to COVID, we're restricted to virtual visits. But I actually had a chance to fly from Atlanta to Seattle, and I visited the campus, got to meet amazing people. Steve, of course, Daren, I'm not sure if I met Daren during my visit, but I got to meet him when I was a student. And I enjoyed the campus environment. It's a very beautiful campus. Oh no, I'm definitely not encouraging you to apply late. No, not a good idea, because well, it worked out, but yes. So, but don't wait till the last minute. But for me, it was just getting to meet the faculty and staff of the Global Health Department, and just hearing the stories of the things that they have all done, and the kinds of students that I'm going to get to learn from and share the space with. So that was what sold it for me. And I had to tell my dad I was moving from Atlanta to Seattle, and he thought Seattle was in another country. So, hey, go figure. But yeah, so that's how UW chose me.
Great. So once you got here, okay, Vijay, do you want to say, once you got here, like, and you made the decision, you can integrate that into your conversation, but what did you find there are some of the pluses of being here on campus and being in this program?
Yeah, so that's a good two-part question. At the time I was applying for grad school, I was actually in Uganda, and I had been working abroad for a few years. And I was really keen on finding a program that would provide a really rigorous global health program, and provide opportunities to build opportunities to try new things, and to learn new approaches, and really to have a cohort of classmates who also had experience, so you could have a really informed and charged discourse, and then a group of faculty who had experience in different disciplines across the global health space. So I actually was probably less likely to come to UW in a vacuum. I grew up on the East Coast in Boston, and my family and friends were familiar and bullish on East Coast grad schools. But for me, as I looked through the faculty, the group of wonderful faculty like Steve, and I looked through the different practicum and fellowships, that opportunities, and I looked at the course structure. To me, UW's DGH stood out far and above of the other schools, and those who were in the field confirmed that. They said, "Look, this is the place to go if you want to achieve your goals." And to the second question that Daren posed, I can say with certainty that there were a lot of the things I was fortunate to do at UW, I would not have been able to do anywhere else. And the biggest part of that is my practicum and thesis that I did in Sierra Leone, where actually UW actually didn't have affiliates who were working on the ground, or faculty who were present working in the country. Yet the program and the department went to great lengths to provide me the support, really intensive support that I needed to do this project I was really passionate about doing, and succeed in it. And that's just one example. But certainly looking back, I wouldn't be anywhere in my professional career near where I am without what I gained from the program. And it's not just the work, that opportunity to do a practicum and thesis abroad. It was the coursework. I'll always remember Steve's class as fondly, but the discourse with really passionate cohort of students and faculty who just made themselves really accessible, and faculty on different areas of public health that I was interested in but hadn't had a chance to engage in. And I was able to learn a lot from those faculty. Faculty would open themselves up to sit down for an hour in the midst of their crazy schedules and chat with you about philosophies, approaches in global health, and really provided a lot of practical guidance. So anyway, just some of the reasons, but
I asked you a question, sorry, but thank you for answering that. That's really important. Maybe Lily, you can talk a little bit about your some of the bonus or pluses that you found once you got here.
Yeah, definitely. So just to, I know you didn't ask for the first part, but I came in through the post-bachelor fellowship program through the Institute for Health Metrics and Evaluation. And so I was working at IHME most of the years I was doing my MPH, and I would, similar to Vijay, I think a lot of what was most pivotal for me about the MPH program was the practicum experience. And I ended up, I did my practicum in Mexico at the National Institute of Public Health there, and was only able to kind of locate these awesome professors and connections that were working on abortion access work there through the connections to professors at UW. And I ended up doing my practicum there and then staying and working there for a year and then coming back and finishing my MPH. And so I think a lot of it was both the initial connections to the folks there in Mexico and like the really strong relationship between IHME and INSP in Mexico was like huge. And I think also just the ability to take that time to do work there and work on that development and then be able to kind of come back and integrate back into the MPH and the like flexibility and grace through which the program like responded to that, I think was huge for me.
Thank you. So you all came in, you started school, and you had probably a million ideas what you wanted to do in global health. How did you end up making a decision what you would end up doing for your practicum and thesis, and how did you get the guidance to do that? And yeah, so what are some of the resources that you tapped into while you were here to help hone some of your interests? Because I'm sure you have many, and especially then you probably had the world was wide open in terms of the things that you wanted to do in global health. Anyone? Farah, would you like to start?
Yeah, thank you so much. So what supported me is the practicum. I was fortunate to work in HAI with a great team, and I was, besides global health, I was interested in the needs of the immigrants and refugee population within our county. I was able to collect some info. I did need assessment, and I was able to collect some information regarding about this specific population. And for my thesis, I was fortunate to work with our Julia Robinson at the HAI to collect some information on, data collection on FGM, female genital mutilation, in regards to the perspective of men, and that's how I was absorbed into the needs of the local population. There is huge need when it comes to health disparities. Where you live within our county, your zip code determines your health outcome. And I was initially I wanted to do some work in internationally. However, eventually I realized that, there are more needs to be done here. So, and, the networks that I've created over the years, the relationship that I had with faculty, with community organizations have been, very helpful in getting job opportunities and other resources within our community.
Great. Onyinye, would you like to comment on that?
Yes, I would say my staff advisor was critical in helping me find my practicum opportunities. And at that time, I had Krishna, and I'm trying Krishna, which many of you don't know, but Krishna was my advisor. Also, Steve was my faculty advisor. So they both were helpful in helping me find an opportunity. So I did my practicum at Gilda's Club Seattle. It's a cancer support organization. I'm not sure how active they are presently, but it was at that point I had some interest in cancer because in college and high school I had done some fundraising, and cancer is a cause that is dear to my heart, and I just wanted to learn more about supporting patients that are dealing with cancer. And so Gilda's Club Seattle was where I did my practicum. But for my thesis, I got to travel to Kenya. So my thesis was quite, I don't know, I mean, at UW, things kept choosing me because I actually didn't have a clear idea of what do I want to do in terms of women and adolescents. But sexual and reproductive health is something I've always been passionate about. So one day my staff advisor was like, there's this organization, they're based in Spokane, Washington, but they're looking for someone to go to a village in Kenya to do an assessment of their child malnutrition project. And I had no background in nutrition at all, but they wanted an MPH student because they were working in a community that had a very high HIV prevalence, and they started this nutrition program, but most of the children were dying. So they wanted us to go and figure out what was going on. And so anyway, I was able to apply, and I got the opportunity. So I was able to take courses like Donna Deno's course in maternal and child health. I also got the Go Health Fellowship. So that's one resource I want to highlight as being very helpful in helping me do my thesis. So that helped cover my travel and my accommodation while I was in Kenya. So I would say my staff and faculty advisors and the Go Health Fellowship were very critical in helping me have a successful practicum and thesis. And my thesis advisor was actually Dr. Grace John Stewart, and I know she's still at the college as well.
Great. So yeah, at the Department of Global Health, we have connection to a number of fellowships or small amounts of money that are able to students are able to access to support travel and project expenses for short-term projects. And so that's a lot of our students are able to access some of those. And we have students present their project ideas, and the faculty committee selects them. So you can find out more about those. You can look on our website under the Student Services tab. There's more about funding opportunities, and do a little bit of a search on that. In terms of this is for Vijay and Lily. You created or you organized a practicum and thesis. How did the skills what are the skills and what are the things you learned in those experiences that then you were able to bring to your current work? Things that you do now that you're like, oh, wow, I'm great. It's good that I had that experience because now I can do this. And yeah, and you impressed yourself. Like, wow. Yeah,
sure.
Go ahead, DJ.
Yeah, I can go. So I had never worked in I'd always worked in developed settings, more developing, stable settings like in Uganda, and I'd worked in Swaziland. But I was really keen on working in fragile states and humanitarian settings. I had been for a while, and the first time I was able to do that was through my practicum. I was working for, had a chance to work with a local NGO, manage and implement programs in that context, particularly in rural areas of Sierra Leone. And at that time, it was still much closer to coming out of war, and also was doing my thesis research alongside that. So from there, I mean, I really gained direct experience in kind of rolling out and then managing projects for sort of grassroots level at local level, and doing research and really intensive field research in but with rigorous standards in rural, hard to reach areas, and that has really served me well. In particular, I mean, right after I finished my program, literally immediately after the Ebola outbreak emerged in Guinea and then in Sierra Leone and Liberia. And so I was able to kind of take advantage of my experience in Sierra Leone and the wonderful training at UW. And I was managing a larger, I was working with Coal Global and managing a large response and also multi-NGO response, consortia response across a number of areas to the epidemic and its primary and secondary impacts. So right off the bat, it definitely it helped me because I had that experience in working in fragile states. And one thing I would just add is that in working in humanitarian settings and fragile states, it's not the easiest thing to get in the door because often and as having been a person hiring as well as trying to get hired earlier in my career, you really need people who you can be confident will be able to do the job, and experience does matter. It's just you can't afford to learning curves are in terms of time are hard, because if in a humanitarian crisis things have to get done immediately, there isn't really a margin for error. In this case, it really helped me get that foot in the door, allowed me to have a learning curve, but also it positioned me for future work in the humanitarian space.
Great. Lily?
Yeah, so my practicum and thesis were both in Mexico, in Cuernavaca, and I was mainly looking at abortion access. And I think most basically how it's translated into my job now is that I still work bilingually in English and Spanish at the county health department. So I do a lot of our Spanish language communications, and my practicum and thesis was kind of one of the first times I was working professionally in Spanish. And so I think just like having that opportunity to do research in language and work with other professors there was a big part of kind of building some of my confidence around my language skills, and is a big reason that I still do bilingual communications now. I would say also with the thesis in particular, abortion data is really messy, as a lot of data is, but I think I feel like I learned a lot about how to kind of like pivot, kind of like a short-term project, like going in with initial ideas of what I wanted to do, but just like the realities and the constraints of the data and who I was able to talk to meant that I feel like my thesis changed a lot, and that happens regularly with work as well. And so I think that kind of like taught me a lot of those soft skills around just kind of like working within constraints and working with like really messy data. I would say lastly, so now I work in communications, and a lot of my thesis and practicum kind of working on the topic of abortion in a heavily Catholic country. I feel like I did a lot of communicating about stigmatized issues. And I would say that in my role now, kind of like navigating some of the nuances around particularly vaccination, but also sexual health and a lot of other topics were kind of muscles I started to flex during my thesis and practicum when it came to like, how do you communicate around something where there are a lot of.
Great.
Oh.
So I see Sarah Hansen has joined us, and so welcome for all the PhD students in the audience. I'm sure they're excited that you're here. Would you like to introduce yourself? So your name, the year that you cohort you were in, you were also in the MPH program here, correct? And then we also want to know what you're doing now currently, and you can say a little bit about why you chose the UW for a PhD.
Sure. Hi, everyone. Sorry I'm a little bit late. This is Marin. She's homesick today. Yeah.
Oh.
So I did the MPH in global health metrics in 2010 to 2012. And I was in the first cohort that they opened up to non-PBFs. And then I started my PhD right after in global health metrics. So that was the first year that they started the PhD. So I was kind of a guinea pig for both programs, which was really interesting and fun in a lot of ways and hard in some ways too. They've smoothed out a lot of the process by now, which is really wonderful. It's a great program. So I chose the PhD. I mean, I decided to go straight into the PhD because I knew I wanted it eventually, and I knew that it gets harder to do as time goes on. So I just wanted to go straight into it. UW, this was really the first program of its kind, and so it made sense for me. It took me 7 years. I graduated summer 2019. So it was a long one for me because a lot of life happened along the way, and just difficulties with the dissertation too, having delays with data and problems with data, and certain parts of the analysis taking much longer than I anticipated. So yeah, long dissertation, but I mean, worth it in the end, and I'm done, which is great. I recommend finishing.
Yeah.
And my dissertation was basically, so I've been at IHME for over 10 years now, 10 and a half years, because I was there kind of through both programs. And now also, I like working there a lot. I've been on the Global Burden of Disease project for the majority of that time, with some other project work interspersed in there. And I just enjoy descriptive epi. I like the challenges that it brings. I like the usefulness of it. I like the creativity that it involves and the problem solving. So I'm working now, currently my project right now is estimating the non-fatal burden of COVID. And so it's really interesting and really challenging. We're looking at the burden from the acute phase, but also from long COVID, kind of these lingering symptoms that continue for months out. And so it's really, I mean, it's fascinating, and it's exciting to kind of be working with these collaborators around the world who are gathering this data and who are so committed to sharing it with us, and they're so committed to the data being useful. And and helping people who've been affected by COVID. So that's inspiring. And I'm on a new team at IHME it's a mouthful. It's the non-fatal and risk factor quality enhancement team. And I'm working with Teo Voss. We're a small little team, a couple other people, looking at the global burden of disease and opportunities for streamlining or improvement or building in more consistency over GBD rounds now that it's iterating every year. I'm going to have multiple updates a year moving forward for some areas. So yeah, that's kind of what I'm doing now. And
we're glad you came and glad you're here, and nice to meet you, Doctor. Wanted to have a chance for other people in the audience to now ask a question. You can either field a question by unmuting yourself and asking it, or you are able to type into the chat, and Nora Yusufa here will relay your question to us. I just want to point out Julie Burnett is here. She's a staff advisor for students, and just wanted to, and most of you know her already.
So Sabrina, I know you had a question, so please feel free to go ahead and ask it.
Thank you, Nora. Hi, everyone. My name is Sabrina. I'm currently a grad, senior in the public health, global health major. Can you guys hear me well? Great. I was curious to know how MPH alums were able to afford grad school. So if you could please share some tips. I also had a second question about how undergrad students can better prepare themselves to be, I guess, competitive applicants for grad school.
Great. So funding, a little bit about funding for any of these people here in the audience, and also anything you would recommend for somebody to be a competitive applicant to your programs. Anyanya or Lily, do you want to start? Or?
Yes, I can start. So I'm laughing because I was an out-of-state student. I was excited to leave Atlanta and moved over to Seattle, but I was a Gates Scholar, or I'm still a Gates Scholar. So the Gates Millennium Scholars Program covered some of my expenses for grad school, but I had to take out loans. That was actually my first time taking out loans for the master's program. But during my second year, I was able to get a TA-ship with Dr. Ann Downer. She taught a course in leadership, global health leadership. So I was able to serve as her TA, and that helped with my expenses as well. Regarding being a competitive student, I believe, of course, your grades, making sure that if you're competitive grade-wise, you have an advantage, but also it's also about reaching out with your interests. So are you, depending on your research interests, depending on which professors you can connect with to find out what RA research assistantships might be available, or teaching assistantships will be available. But yeah, so I benefited from a scholarship, benefited from the TA-ship, but I did have to take out some loans because I was an out-of-state student.
Lily, do you want to say something about it?
Yeah, pretty similar to Onyinye. I had most of the MPH covered through the post-bachelor fellowship program through the Institute of Health Metrics and Evaluation, but I did then take a year off, and part of that was to work in Mexico and also to kind of figure out how to fund the last part. And so I also, for the last year, had a research assistantship, and I think, it didn't, I ended up working with Professor Carol Levine, who works on Global Health Cost Consortium. And that was a really cool connection. I loved working with Carol, and I wasn't totally into health economics, but it was like, I think it was a neat way to kind of like work on something that was kind of outside my interests and also had money in it. And so I think there, are some like real trade-offs there where like I would have probably wanted my research assistantship to be more in line with the reproductive health, but kind of like, I think in some ways needing to be resourceful around money stretched me. And I learned a lot about health economics that I don't think I would have pursued otherwise. But yeah, I would say campus jobs are a big one.
Sarah, what about a PhD? And how did you find funding for your initial years?
So I worked at IHME for most of it. I tended to mix in TA-ships, being a teaching assistant, because I like that a lot. So it's also, I believe, still required or recommended at least. But I enjoyed it. So I kind of mixed in TA-ships with research associateships at IHME. And then eventually my funding ran out because I took too long with my PhD. So that's when I also picked up some TA-ships at the end to kind of finish it out. So that was handy to kind of fill some gaps along the way, to have one-off TA-ships.
Thank you. Nora, would you like to ask the next question?
Yeah, so for Farah and Vijay, there's a question in the chat box from Anisha who asks, how easy was it to get a job in the field upon graduation?
I just want to go back to Sabrina's question. Sabrina is an amazing student. She works with a project that I'm involved with, a project that is addressing COVID-19 testing barriers within King County. So she's already amazing, and she's very competitive. Ensure that when you're applying to the program, that you mention all the great work you're doing within the community. I would like to revisit also the question of funding. I am a father of 6, and by then, when I was going to graduate school, I was, having kids to an extent. Someone asked me, did you take some family planning classes? So I think there are resources within the university. It's a matter of talking to the right people, relating with with people, and unless you express your needs and nobody will know. So I was very fortunate to have been supported by Julie, who's here in the discussion, and other wonderful people in the School of Social Work. So, and I also gathered some fellowships to finish the program. And the other question there was, what was it? I was just so absorbed into the other one.
The other question was, how easy was it to get into the job field upon graduation?
So
Vijay as well.
So I think the most challenging experience is, looking for a job. So you apply to some places, you don't immediately get even invited for an interview. One thing that I will say is, I think one thing that matters most is having, there are two things. One, go to school and be successful in your classes. And the other thing is build some relationship as you go, take classes, know your faculty, know your cohort, and also reach out and know, people who are in the community. So I had very good relationship at different levels, and some of the jobs that I got, it's through the connection that I had with people. I remember the first job that I got was through the invitation of a colleague, and they said, Fra, we have this opportunity, would you be interested? And by then I did not have a job. And yes, I accepted. That was a research coordinator position with the UDAP. And as I did that job, and then another colleague that I connected over the years, said his manager is looking for a job, to hire someone, and would you be interested? And I said yes. And I submitted my resume to him, and he just shared with the manager. And after a while, the manager invited me for an interview, and that was the city of Seattle. And from there, and then it's through connections. So one thing that I would say, and I cannot say a lot, is networking. It's who you know. It's the relationship that you build with people. And unfortunately, sometimes unless you have that relationship, it's very difficult to challenging, not difficult, to easily find a job. Thank you.
Great. Vijay, want to also ask you to add to your question, just sort of about how you found your job, but about finding a mentor and making these connections that Farah was talking about. How did you find a mentor and get advice from them, and did that help you to find throughout your time and find your work, your first job?
I would say, that's well said. I mean, for me, I looked at the kind of list of faculty, and when I first came, right when I started, and even beforehand, to see what different faculty were working on, what projects, what research. Then I just reached out to them. As I mentioned, it's a great culture at DGH. Has a really wonderful culture of faculty being really open to meeting and discussing. I think right off the bat with Amy Hagopian and James Pfeiffer and Gabriel O'Malley. I remember meeting with Steve shortly after I came, and Deepa, in addition to our staff advisors, touching on areas of either areas of interest where I hadn't done work or research in before, or areas where I had done work, and I was interested in expanding further into those areas, into that subfield, or finding, looking into new opportunities. And through these conversations, I learned a lot about not only what the faculty were doing, but they would provide advice or guidance on different avenues to pursue, or different people to talk to, different affiliates that were working on different things, and also they would also give examples of what other students had taken on as examples. So kind of there was a really good brainstorming, and then it was really just helpful to learn and hear different perspectives. But it was kind of over that those kind of discussions that I think the relationships can organically develop, and ultimately that can build into deeper relationships. And I was, Gabrielle O'Malley was my thesis faculty advisor, as well as Grace John Stewart, and I worked with also Grace on a few other projects as well. And so my advice would be to start off early on in networking with faculty. There's such an amazing group. It's just really diverse, different backgrounds, doing different types of work, and all across the world. And in Seattle, which is global health hub globally. And in terms of so I'd recommend that to do that really early on, and it never hurts to reach out and have conversations, and you'll learn a lot. And over time, that can really help you when you're trying to figure out what you want to do with your thesis practicum or post graduation. In terms of finding a job, I found that to be difficult. I mean, going through job searching is it's not easy. But I think it was helpful to be able to cite the experience of my practicum and my thesis, and having done that work abroad in a really practical public health practical context of public health practice, how I would put it. So having done it in that, it was easier to that was a selling point as opposed to having just come out of.
I know. Yeah, I know that you had mentioned that earlier, that just the field that you were interested in, they really wanted an assurance that that anyone they brought into their team had some experience in those areas, and so you were able to capitalize on the work that you did as a graduate student to actually prove that to them and to be able to make that first step into the field that you wanted to get into. So, I know, Anyanya, do you have something to add to it? But I love all the suggestions you're all giving to the students. And
Yeah. Yes, I wanted to touch on Lucas's question about advice for finding a mentor and cultivating that relationship. Mentorship is something that I am so passionate about, and I should give a shout out to my mentee who is on this call, Ifunanya, all the way from Nigeria. Ifunanya and I, we haven't met in person, but we connected through my mentorship program, and she was a part of that program in January. And today she is in the MPH Global Health Program. I mean, because she's awesome, but also because of our mentorship relationship. So I just want to say my first mentor, real mentor, I think she found me again at UW. I gave a speech. I was selected to give to represent the students when the Global Health Department opened up. And I gave a speech. She was one of the board members at that point. And afterwards, she came up to me and she's like, "Oh, wow, like you spoke so eloquently. We should stay in touch." But what I want to highlight from that relationship is that as the mentee, you have to be the one following up. Don't expect the mentor to be the one reaching out to you. I think that's one thing that a lot of people get wrong, because you feel like, oh, this mentor is an accomplished person, like they're so experienced. Sometimes you get intimidated to even reach out, but that's how to make the relationship work. Also, Sabrina, I'm sure you guys saw, she posted that we connected on LinkedIn. So LinkedIn is also another way. I mean, I meet so many random people, like I've never met them in person, but they would say they know me somehow, because you connect with them, but also make sure you follow up. And I want to highlight, know what you want. So also, while I was in the program, one of my friends had the chance to go to the WHO and do her practicum with one of the leaders of the Adolescent Sexual and Reproductive Health Department there. When she came back and she told us all the great things she did, I actually got his email address and I followed up with him. I said, "Hi, you don't know me, but I am Onyinye. I'm very interested in adolescent sexual and reproductive health." Long story short, today he's one of my recommenders. He's somebody that even before we met, we had been constantly exchanging emails. So I just want to say, make sure you know what you want when you reach out to people. Let them know what kind of relationship are you looking for, what kind of opportunities are you looking for. But if you're interested in learning more, I'm happy to be a resource. And but definitely know what you have to offer, your skills and your experience. They do speak well when you're connecting with someone. Don't just go say, "Oh, I admire all the things you're doing. Like, how can I be like you?" Like, like, all right, I'll stop there.
great. Well, I just want to, we're coming at the end of the session, but I do want to reinforce that we have a session with faculty tomorrow from 1 to 2 about global health and social justice in the context of public health careers. So you can get some faculty perspective on finding mentors and talking to them about the work that you want to do. And then we have a practicum session on March 3rd, if you're interested in learning more about the ways in which people integrate their practicum into their academic career and their work. To close, I would like everybody, if they can just say really briefly, some piece of closing advice that you didn't get to say today, but you'd like to give to someone like yourself who was entering a program or trying to make a decision whether to come here to the University of Washington? Why don't we go backwards in alphabet? Vijay, Sarah, Onyinye, and then Lily and Farah. So Sarah or Vijay first, and then.
Sure, Darren, can you repeat what the question was?
Just anything that you want, any short piece of advice that you think that one more thing that why you came, what would make you come here, and or when you're a student, what you'd like to have known.
Yeah, I would say the fact that there's just more than when I applied. Was when I came here that I realized it was such a breadth and depth of opportunities to engage in different internships, fellowships, just courses, coursework, relationships across a wide swath of global health and of public health, the public health field. And through the different university affiliates, and even within the School of Public Health at large. And so that's something I really don't think you'll see anywhere else with regard to global health.
Thank you.
Yeah, that's really emphasized.
Thank you, Sarah.
Hi. For the PhD program, I think, UW, the research happening at UW, the professors here are just incredible for both the MPH and the PhD. I think it's an exciting place to learn and to do research. I think it's important to, maybe especially with the PhD because it's longer, to prioritize your support system. And because it can be I found the PhD much more than the MPH to be pretty isolating and difficult in some ways because I'm very much a team person and a people person. So that was really important for me, and it's a long haul. So just prioritizing personal life and support system, bless you, is really important. And also being realistic and really learning your boundaries and getting better at scoping. This is maybe just me personally, but that I needed to get better at that, and I did. But that was really important for me because there's lots of cool stuff to work on. It's easy to say yes to too many things or to get spread too thin. So really, focusing the work when you're doing research and thinking about where you want to end up and taking a step to get where you want to end up in terms of, who you connect with, who you do research with, that kind of thing.
Thank you, Sarah.
Yeah.
How about Onyinye?
Yes, I would say come with an open mind, but be very eager to learn. I mean, UW till tomorrow, forever, I will always toot their horn. It was such a great learning and growing experience for me, amazing faculty. Some of my best friends are from the graduate school. Like I have a friend in Australia, from South Sudan. We're still very much in touch. And these are people that I look up to as mentors and role models. So I would just say it's going to be intense. And when you take courses like with Steve that challenge you to think critically about global health, how come we've been doing all these programs for so many years and we still have such large cases of HIV, and we still can't address infections like COVID and Ebola. But you have to just really think about the structural issues that we have to tackle. So I think I'll just say, come with an open heart and be really eager to learn and connect with people, and you have a great experience, trust me.
Great. Lily?
Yeah, I would just add, I think one of the things I've reflected on is that it's pretty basic, but that it's okay to take your own path. And I think it's easy to, especially when you're in a cohort, to do a lot of comparison to other people and how they're doing the MPH and where they're getting their practicum. And I think that there are a million different ways to do it, and that yeah, it's okay to not be doing it the same way as everyone else, and that doesn't mean that you're not getting a lot out of it or that you're not going to end up in a place that you want to be. And so if that means taking time off or setting boundaries or taking different classes than others, I was in the health metrics track and still do some data, but pivoted pretty hard to communications, and just like being okay with that, and that those being like both things that are a part of me and the work that I do, and it doesn't need to be kind of this like linear story of your MPH and your career. So yeah, thank you for having me.
All right, we'll close with Farah.
Yeah, thank you all, and thank you for this opportunity to be with you today. The only thing that I will say about I had amazing experiences at UW, Department of Global Health, and the things that I can remember is the support that I got from the staff, faculty, and students as well. One of the qualities of the program is they are very diverse students with very in-depth experiences that you can tap into. So if you are thinking of, I don't know if all these students are admitted into the program or they're thinking of going into a graduate school, but I think this is the most amazing program that I can think of, and because of the support that you will get from staff, faculty, and your cohort. And one thing that I will stress is that sometimes we think, about debt when thinking about a graduate program. I think there are resources, and you may be able to graduate without debt if you look for resources. And there are resources, and talk to people. Apply to different fellowships and scholarships, and you may finish the program without debt. And thank you.
Thank you. I want to thank everyone who shared their time today with us, and all of the participants who came, and the audience members who are prospective students, and the faculty and staff who are here today. We hope that you will take all this great advice into consideration when making your decision about the programs. And I know that I see people in the chat sharing their email addresses and LinkedIn profiles and things like that. So if you're interested, check the chat box out.
So you don't have to rush about the information in the chat box. I will be putting all that together. So you don't have to worry about getting the LinkedIn. I'll reach out to the alums, get their information, and share it if they're okay with that with you all, as well as the tips and everything from the chat box, along with the recording. So I've got you covered.
Great. Thank you, Nora.
All right. Thank you all thank you, Daren, for moderating. There's some more events this week. I hope you're able to attend. Let me know if you have any questions. Thank you again, Daren.
Oh, you're welcome. All right. Nice to see everyone today. Thank you.
Everyone.
Have a great day.
Bye.
Thank you. In touch.